I'm sitting here today with Dunn, and Dunn, you're in from Colorado,
Right?
and we treated you a little over 3 years ago.
Yes.
And you were having quite a bit of low back pain that we
Right.
determined was from a desiccated or dehydrated lumbar disc. And we treated you with stem cells from your bone marrow and fat and used some exosomes directly into that lumbar disc. And please tell me a little bit what your pain was like before the treatment and then how you've been these last 3 years.
So I started by hiking up Pikes Peak too far and not in very much shape, and I jounced on my way down the trail, so something like 7 miles. And so a couple days later, I bent over and twisted and slipped a disc really hard, and the MRI showed a bulge pressing against my spinal cord, and I still very occasionally will feel pins and needles in the soles of my feet from that.
Mm-hmm.
It took me a long time to get the Air Force to do anything as a retiree. Eventually, they agreed to me to have a consultant go talk to the head spinal surgeon for the Denver Broncos up in his facility. And he looked at my MRI and he said he could do a spinal fusion, but the two discs on either side of the bad disc were starting to degenerate. And eventually, if you do the spinal fusion, you put more pressure on the discs on either side of that. And he said, just look into stem cells. So I started researching stem cells, and I found your TED Talk on YouTube, and just everything you said in that TED Talk clicked with me, and I liked you immediately, and I liked you when I came and met you, and I believe that your purpose here is to reduce pain for your patients, and it really worked for me. When we first started talking, I mentioned that I had these other two discs on either side starting to degenerate, and so for a slightly additional fee, you did all three of them.
Mm-hmm.
And within a few weeks, the pain started going away. I had to walk everywhere I walked with hiking poles. I came in here with hiking poles.
I remember.
Today I didn't come in here with hiking poles. In fact, I do use the hiking poles for my knees right now. I walk a mile every day. Takes me about half an hour to walk a mile. Even though that hurts the knees, it seems to have been good for them since they really started hurting. They're hurting less because of the walking every day, which is new for me. I used to walk maybe 2 or 3 times a week. So over the course of these last 3 years, the back within a month or so felt fine, and I wouldn't try running or anything, but I could walk as far as I wanted to, and I didn't need to use the poles anymore. And I was taking ibuprofen several times a day to reduce the pain before the surgery, and didn't need any kind of drugs after the surgery. So
That's great.
I'm hoping this time we can do the same thing for my knees.
Yeah, today. So that's right. So today we're going to treat your knees because your
Yes.
back sounds like it's good. So if you had to pick a percentage improved, what would you say you have?
95.
That's terrific.
Yeah.
That's terrific, Don. I'm so happy for you. All right. Well, let's get at your knees today
Okay.
and hopefully get you all the way there.
All right.
Thank you so much. I really
You're welcome.
appreciate it.